So we're going to talk about allergy and infectious disease. I put a little bumblebee in a little, scrub top and mask because one of the big allergies is people with bee stings and whatnot. But yeah, so let's get started. So first we're going to go over the anatomy of the immune system and the lymphatic system. And the lymphatic system is where you have interstitial fluid composed of lymph vessels, lymph nodes, glands, tissue, all of that kind of stuff that it creates monocytes and lymphocytes to pass from the bloodstream through blood capillaries into spaces between a cell. So basically it helps to, detect anything abnormal, so that way your immune system can start fighting off any disease, disorder, allergy, virus, whatever it comes into contact with. So this is where you have all of these different lymph nodes, glands, all of that kind of stuff. So and a lot of people don't know you even have lymph nodes in your intestines too. So like if you get a stomach bug, then your lymph nodes in your intestines then swell as well, so that way it can help get rid of the whatever virus it is that's causing you to have that stomach bug. So, but you'll notice a lot too, like when you have a sore throat or flu or something, that the most common area people notice, like their lymph nodes swelling, is in their throat, like the sides of their jaw and everything. They'll notice that there is some swelling there. Sometimes underneath their armpits as well. Those are the most common areas people notice when they come down with a cold or something, is those areas where it feels swollen. But yeah, you have lymph nodes everywhere. So, but its whole purpose is basically if it comes in contact with any virus, bacteria, allergy, anything, it activates so that way it can, bring those white blood cells and everything to help process out whatever it is that it came in contact with that it's trying to fight off. So, yeah. So I put in a video here, and my speaker is not working today. So I was going to play this video, but what I'll do is I'm going to post this PowerPoint in your guys' slides, so that way you can see like how the flow of the lymphatic fluid works. But it moves in one direction. It helps to prevent pathogens from flowing through the entire body, which is why you have so many lymph nodes and lymph glands in different places. So that way it can stick to that one area and fight it off there instead of it going everywhere. And now you have a whole, total body thing going on. So, but it filters out microorganisms as it passes through as the lymph nodes pass through the various capillaries and blood vessels. But if you watch this video that I included in here, and again, I'll post this PowerPoint in your guys' course right after this, and this video, so you guys can watch it and see how this works exactly. So, oops, my speaker doesn't work, so for you guys to hear anyways. All right, so you have your white blood cells, or the granular white blood cells, which are with neutrophils, eosinophils, and basophils, which we learned about a few chapters ago. But the neutrophils, they are pretty aggressive at getting rid of anything that it comes into contact with. The eosinophils are involved with allergies, so if it's something that's causing, like you get stung by a bee or pollen or anything that you're having a response to, your eosinophils are what is helping to fight that off. And then the basophils are helping with the inflammation. So, yeah. So the immune system's primary function, of course, it's supposed to differentiate between what is self and what is foreign. So any foreign bodies, it is going to try to fight off, which we'll get into autoimmune diseases and stuff as well. But most pathogens can be contained by the first line of non-specific defense, and some pathogens get past non-specific defense and have to meet the third line of defense, which is specific immunity. So, but the first line of defense is physical. So like, intact skin, reflexes, coughing, sneezing, chemicals to your saliva, and then the second line of defense would be inflammation, pyrexia, protective proteins, things like that. So your physical defense is like, obviously, your outer skin, where it helps to protect from anything getting inside. So that's why, like, if you have a cut or anything, then you have that open area that something can then get into. But coughing and everything, sneezing, that helps to get rid of any virus, any bacteria, anything that enters your body. So it's trying to get it out first. So that's kind of like your first line of defense, is your body's trying to get rid of it itself by doing these types of, like your eyes are tearing up, so any pollen or anything that got in your eyes, it's trying to flush out. And then it goes into, if this doesn't work, then it starts with the second line of defense. So your body's immune system's kind of kicking in to help get rid of Good question. Let's see, because I am not sure. Hold on, let me get out of here. Because I am not quite sure. Okay, so granular white blood cells contain numerous granules in the cytoplasm. Agranular white blood cells have no granules in their cytoplasm, but a granular is, well, that's not very helpful. Hold on. Oh, it helps if I spell correctly. Oh, okay, so it's a type of immune cell. Well, that has granules or small particles with enzymes that release during an infection. So agranular means that they don't have those small particles with that enzyme that are released. Yeah, okay. But that was one too. I was not quite sure how to explain. So, okay. And actually, there were certain things I wanted to really focus on in here. So, I haven't used Google Slides in a while, so I'm trying to remember how I look at my presenter view. Hold on. Oh, notes. All right, I'm betting that this kind of blocks your view. Can you see like this part, this big box here that shows the notes and everything? Oh, shoot. Okay. How do I make this smaller? Hold on, sorry. I want to know how to get this. Oh, there we go. Okay. Okay, sorry, Delia. Okay, so specific immune means that the immune response is generated against one specific antigen. The response will not be effective against any other antigen. So whatever it is trying to attack, it's being very specific about whatever bacteria or virus it is that it's trying to protect you against. So if there's multiple, then it wouldn't be specific immunity. So it's meaning that, like if you received a vaccine for hepatitis B, you're protected from that specific virus, but not from the flu and other things, if that makes sense. So your built up immunity to one specific bacteria or virus or, whatever, and then, but it doesn't protect you against from everything else again. So, like if you got a vaccine for one thing, it's not going to protect you against everything. So, yeah, my notes. There are specific things in here I want to go over. Okay, so like allergies is another type of immune system response, and you have the different types here. So you have an immediate hypersensitivity, which is something usually when an instant allergic reaction, sometimes to food, insect bites, or latex allergies. So someone who say has latex allergies and puts on latex gloves, so oftentimes will have a immediate response where they start breaking out in hives, or someone who has a severe allergy um, to peanuts per se, like that would be like an immediate response. So type 1 would be like an anaphylactic reaction where someone is having like a life-threatening type of reaction to something. So it's that immediate response from whatever, most oftentimes it's going to be a food allergy or insect bite. So like bees, people who are allergic to bees, they'll start having like an immediate immune system response. So type 2 is a hemolytic disease of the of newborns. So often this is something that does with blood-brain transfusion reactions, which newborns, trying to figure out their blood types and everything. But that's not very common. Type 2 would cause organ damage with systemic lupus. So this is like an autoimmune disease type reaction. And then type 5 is something that is a delayed hypersensitivity. So someone can have someone can be exposed to tuberculosis but not actually obtain it, but then they have, like when they have the skin test done, it shows up that they're positive because it is something that is within their immune system, but they just never actually had any issues with. Or sometimes too, someone can get a organ transplant and then it's a delayed response. So it's, the first few months or something, everything is going well, and then their body starts to reject it. So, but type 1 is the most severe and what you'll most likely see. Sometimes it's not, type 1 doesn't necessarily mean that it's going to be anaphylaxis. It's just an immediate reaction to something. So if someone, again, touches something they are allergic to, and then they start breaking out in hives, or someone eats peanuts and they're allergic to that, and they start to have any of that throat swelling or, or why is it not showing these things? Anyway, someone who has, eats something they're allergic to and they have that immediate response, like their body pretty much, it's like, we need to get this out of our system, like now. So, okay, gotcha. Good. Okay. So I wanted to go over about like autoimmune diseases and like allergy, the different types of testing and stuff that we do as well, and then go over some symptoms and whatnot. But some autoimmune diseases, sometimes this can be caused by a viral or bacterial infection that then triggers an autoimmune response. Sometimes it's overexposure to toxins, weakness in a person's immune system, or imbalance in intestinal microbiomes. So a lot of times with this, what they'll do is this type of lab testing, this is an ANA, an anti-nuclear antibody test, which is one of the most common ones that if they come back positive, they likely have an autoimmune disorder, meaning that their body is basically attacking itself. So they'll also do a CBC, showing us if they have a high white blood cell count, will show any disorder or diseases or disorders or infections. A CRP, C-reactive protein, or an ESR, all of these different tests are what will help us to help indicate what if the person has an autoimmune disease or if they have an infection. So, because if they have a elevated ESR or CRP, but they're negative ANA, then they may not have an autoimmune disease. They might just have an infection. But these really help us a lot in diagnosing or figuring out exactly what it is that is causing their response to whatever issue it is that is happening. So helps us to just know if it's something that's being caused externally or internally. So, but treatments vary depending on the type of disorder and its severity. One of the main treatments now, actually, for a lot of autoimmune diseases is that Humira injection. So they use that a lot for, I mean, like Crohn's disease, lupus, psoriatic arthritis, different skin conditions like psoriasis and stuff. Like they use that a lot, but it just again depends on like how severe it is. But the main goal is just reducing the amount of times that they have a flare up, because usually that's what happens with autoimmune diseases. And it's not necessarily that they are constantly affected. It's just a lot of times it could be, you know, certain things trigger flare ups. So controlling the amount of occurrences, and then also maintaining the body's ability to fight against it. So someone who also has an autoimmune disease, we also want to reduce their risk from getting any viruses or infections because their body is already immune compromised. So they'll have a harder time fighting off any of those viruses or diseases or and whatnot. So, sorry. All right, so one of the autoimmune diseases, this is an acquired autoimmune disease, HIV or AIDS, which is a chronic condition. It it can be treated, but it's not going to be able to be cured. So of course, risk factors though are having unprotected sex or use of intravenous drugs, especially with sharing needles, or someone who already does have this infection. So. But diagnosis is made by testing blood or saliva, and the goal of this is just to slow the progression so that way the person can live a normal life. They now have more things to help prevent people from getting these. Probably have seen commercials for, I think it's called Disco, something like that. So basically to help prevent people from getting this, but of course, you know, other ways to protect yourself from obtaining this virus is, of course, practicing safe sex or abstinence. But they do have medications now too that help the person, you know, live their normal life and just help slow the progression of the disease. So, okay. So Hodgkin's and non-Hodgkin's lymphoma, so the different two types is characterized by the presence of, it's called a Reed-Sternberg cell in the blood, which is named most likely after the very first person that ever had this disease or disorder. Risk factors include, you know, family history. So if someone has had it in the past in your family, someone between the ages of 15 to 30 years old or above 55, men are more likely to have Hodgkin's lymphoma, and then also having had an Epstein-Barr virus infection, which is something that basically is, it'll be with them forever. It's an immune response that they will have. And then non-Hodgkin's is a collection of other lymphatic cancers that are not Hodgkin's lymphoma, which does not explain this extremely well, the difference. So what I'll do is I'll also include a video that explains this a little bit better, because I don't think that this definition didn't explain it super well, the difference between Hodgkin's and non-Hodgkin's and exactly what it is. But so some signs and symptoms of this would be painless swelling of the lymph nodes. So that would be the key. It would be painless. So they're not, because usually when you have swollen lymph nodes, you do feel some pain and tenderness. But someone who has like swollen lymph nodes and they're not having any pain or tenderness, they'll have like some fatigue, fever, chills, night sweats. But the doctor will do a physical exam and then do some of those blood tests that we were talking about earlier to check for, you know, an immune response. Sometimes they might do some type of imaging. Just depends on the severity of the case. And then treatments just depend on what stage they're in. Sometimes it might include chemotherapy or radiation. Sometimes stem cell transplants. But yeah, it is, you know, again, some of those lab testing that they would do to check for an immune response. So multiple myeloma would be cancer of the white blood cells. Plasma cells reproduce so much that they crowd healthy blood cells. So this is a type of autoimmune disease. So your body is just overproducing. It's kind of so opposite of hemochromatosis, where you develop or you're producing way too many red blood cells. You're producing too many white blood cells. So it's just this overgrowth of the healthy blood cells, and then your body's trying to destroy those excess cells. So then your body's basically attacking itself, because then it doesn't know how much to get rid of. It just is trying to basically, attack as much as possible. So then you end up having this issue where your body is fighting against each other, and the white blood cells is what we use to fight against infections. Well, if you have a cancer or disease of your white blood cells, that's pretty risky. So they would do a blood test of your whole blood count. A lot of times they'll do the bone marrow biopsy and look through there, because that's where we create our white blood cells, to see what the issue is kind of stemming from. Treatment just kind of depends on, once they do all these other tests above, then they will determine, what type of test they need, if they need some type of cancer therapy or radiation. Again, possibly stem cell transplants, but it's usually a targeted type of therapy. So wherever they, figure out what it is that's causing this issue, then it's targeted specifically to that area. So viral hepatitis is another type of infectious disease, and I know we've talked about this a little bit before in other chapters. Do you have any questions about hepatitis before we move on to these other ones? Because a lot of these I know we've discussed in other chapters before too. I don't want to have to. Okay, gotcha. All right. So in immune system, so basically, yeah. So with this one, specifically for an immune system disorder disease, with STIs is going to be something that is going to be more long term, because anything HSV, HIV, and HSV is herpes simplex virus, and there's two different types. So this is something that basically settles in the body. So they may essentially, a lot of people don't know this actually. I don't know if this is a fun fact or not. It's not a fun fact for someone that ends up having it, but basically, so this type of virus, someone can get but not even have symptoms for an extensively long time. 10 years can go by where they were exposed to these different types of the herpes virus. They may not have any outbreaks or symptoms or anything for a very long time, may never even know that they have it, and then all of a sudden 10 years later they have an outbreak. So this is something that basically will settle into a nerve, and then yeah, it's exactly like shingles. So yeah, it's you had chicken pox when you were a kid, and then it just settles into a nerve somewhere, and then something triggers it. So, and that's actually a lot with most immune system disorders, where it settles somewhere and you may not always have issues with it, but then something causes a flare-up to happen. But it just settles, usually in a nerve. So, and again, the best way to treat these types of things is just to try to figure out what it is that is causing the flare-ups, and then reduce the exposure or whatever is causing these flare-ups to happen. So sometimes it can be stress, or just trying to reduce the amount of stress in someone's life to help reduce the amount of times they have their immune system or their autoimmune disease flare up and everything. So strep throat, that's another one. I know we've talked about this before too. As a way that your body, your immune system or your lymphatic system responds. And this is a lot of times too, where most of the time people notice they have the swollen lymph nodes, is because they get strep throat. I know we've gone over this before, so do you have any questions about strep throat before we go into the flu, RSV, or any questions about the flu or RSV? I know we've gone over these different ones too. And I cannot remember, did we go over mononucleosis? Okay, gotcha. And this is a pretty highly contagious. So basically, oops, my phone thinks I'm talking to it. Sorry. So if you have direct contact with someone else who has an active infection of mononucleosis, signs and symptoms would be fever, fatigue, swollen lymph nodes in the neck and armpits, sore throat, skin rash, swollen upper abdomen, and I don't know why it says fatigue twice, but I guess because you do get very tired when you do have this type of infection. So diagnostic procedures include, they'll come into the doctor and they'll do a exam. The blood test they do is usually something we do in office where we actually just take, it's like a finger poke, and then it's almost kind of similar to like the strep test where you have the two different solutions that you put into the little vial and then you have a test strip. But it's just with blood instead of like using a swab on your throat. So, but antibiotics are not really necessary or very useful. Treatment, it does take a while for them to get over this, but treatment usually is just lots of rest. So, and their body will usually fight off itself, but it is highly contagious. They usually call it the kissing disease, especially like for younger teenagers and stuff. It's pretty contagious. Someone who can just, like you share a drink with your friend. One of the most common ways that you get it and everything. But anyways, when you have a patient that comes in with any of these different viruses, or they come in with a cough, sore throat, fever, they're complaining of fatigue, itchiness, any of that, you always want to wear a mask. Of course, which pretty much right now I don't think anywhere you're going to work. And I think I don't know how long term this is going to be, but I think in general now you're pretty much going to be wearing a mask regardless of any of these people's symptoms. But of course, you always want to make sure that we're wearing the right type of PPE. We may not know always, of course, right away what someone has, so we don't necessarily know like if we need to use an N95 mask or whatever. But wearing a mask in general, like if someone comes in, they're complaining of cough or a fever or fatigue, body aches, anything like that, just to help protect you from getting any of those illnesses or viruses. So some pretty common allergens would be, so sometimes medications can cause allergic reactions. Someone is here to deliver something. Hold on one second, guys. I'm so sorry. Oh, sorry about that. Oh, so some other common allergens could be medication related. Penicillin is like the most common antibiotic that people are allergic to, as well as sulfa drugs. Um, and then also NSAIDs are another one that are pretty common for people to be allergic to. But environmental, so dust, pollen, pet dander, usually a lot of times during springtime is when people will have, allergies caused by those environmental factors. And then foods, most common foods people are allergic to are peanuts, eggs, shellfish, and wheat. So, and there is skin testing they do for people, which actually there is, treatment for this. Let me go into testing first, and then I'll go into treatment for this. Actually, sorry, but skin testing. So usually, what they'll do is usually either on their forearm or upper back, which is usually on their back that they do this. But they, like an allergist, will take certain things that someone might be allergic to and then do a patch test or a scratch test, where basically they'll take whatever it is that someone might be allergic to, and then they will put it in they kind of make a grid. Let me see if I can actually find a photo of that. But they'll make a grid and they'll put that specific object, whatever it is that they might be allergic to in an area to see if they have an allergic reaction. So let me see if I can find allergy skin test on that. So yeah, so they kind of make like this grid where they will put, so like this particular person, they put all of these different outdoor types of things. So trees, grass, weeds, indoor things, you know, and mold. So, so basically, like you can see on here, this person has a pretty big reaction. So that shows us that this person is allergic to this birch tree, or that they are allergic to sage. And also they're allergic to cats and things like that. So they'll do these different types of skin tests to see what exactly someone is allergic to. Yeah, it's pretty itchy. And that's the hard part, is trying to make sure, you know, whenever they do this, that they don't itch at it, but they'll usually put this covered tape on top of it, so that way it kind of helps protect from, you know, if they do scratch or anything. But that's what they'll do, is they'll make it into like this grid, so that way, let me actually go back to this, they'll write it on like a piece of paper, so that way they know exactly what it is that they're having an allergic reaction to. So again, here we can see like this person is allergic to birch and oak and sage, dust mites, cats. You know, we can tell what it is that they're allergic to, because what they'll end up doing is they will usually make a serum. Well, yeah, that person's allergic to like everything. But like an allergist will create a serum of whatever it is that they actually are allergic to, and then what they do is over time, like they're trying to build up their immunity to those things. So they'll start off with a very small dosage of whatever it is that they're actually allergic to. And this is something us as the medical assistant does. It is a little bit scary at first, but you know, the allergists are really good at what they're doing, and they'll usually have the patient come to them first to do the first, you know, few injections. So that way, in case anything does happen, they can make sure that it gets, you know, taken care of right away. But you know, you do really want to be careful when we are giving allergy injections, because there is a particular way you have to do it. You have to slowly build up their immunity to it. So it usually starts off with them getting a really small dosage. And they'll do that like once a week, sometimes 2 times a week, where they'll come in, we'll give them and sometimes it can be 1, sometimes it might be more than that you'll have to do, depending on like the solution that they create for them. But for allergy injections, so they'll come up with whatever it is they're allergic to in the vial, and then you do it subcutaneously. So you have to make sure that you follow the directions, because usually they'll come in and they'll say they're going to do 0.1 mLs this week, and then next week they're going to come in, they're going to do 0.2, and then the following week they're going to do 0.3, and they just kind of build it up. With the allergy injections, you just really have to be cautious, because so once you give the injection, they're going to wait in the waiting room, usually about 20 minutes, because then we'll be able to tell by that point if how severe their reaction is to it. So, and we have them in the waiting room because, of course, in case anything happens, like they have an anaphylactic reaction, we don't want them to be in a room behind a closed door where we don't see that they've stopped breathing. So we want to make sure someone has eyes on them. But after the 20 minutes, after you've given them their allergy injection, you're going to check the wheal. So basically the localized reaction around it, because irregardless, they're going to have some swelling and a reaction around there, because obviously we're injecting them with something that they're allergic to. So there's going to be some swelling there, but depending on how much swelling there is, sometimes you might have to just repeat the dosage of what you gave them the next week instead of going up. Or sometimes you might have to go down. So, you know, where it's like this time we gave them 0.2 mLs and they had such a large reaction that the next time they come in, we just need to go back down to 0.1 and slowly build them up, rather than continuing, you know, increasing, because then if you do that and they do have a large reaction every time, basically they're going to end up having an anaphylactic reaction at some point. So, not good. We did have that happen once with a person. This was actually kind of, it wasn't funny at the time, but it was funny afterwards. But basically, because we used to give allergy injections to people like all the time at an office I worked at. This one particular time, this person did have, hold on one second. Sorry, tequila. But anyway, so this guy came in for his allergy injection, and I don't know exactly what happened because I didn't. It was another nurse that gave it to him, so I don't know if like she went up too much. There's a lot of factors into it. Like if a patient, you know, that like last week they were supposed to come in, but they didn't, and then you still continue going up, you're not supposed to do that. So I don't know exactly what the circumstances were, but anyways, this person, she gave him his allergy injection, and I don't like within 5-10 minutes or whatever, he kept like clearing his throat. And usually, like when they start clearing their throat, that's an indicator that they're starting to have some swelling going on there, and that their airway is going to close. So, but she didn't think much of it at first. But then he started breaking out in hives, and then started really like he was having a hard time. Started to have a hard time breathing. So, anyways, me and another nurse were closer by, and she had yelled that she needed help because he was starting to go into an anaphylactic reaction. So me and this other nurse grabbed a crash cart, ran into the procedure room, and we were trying to give him epinephrine, the EpiPen. Have you ever seen an EpiPen before? Cool. Okay. Yeah, it's just a preloaded pen that has a needle already in it that's like a triggered response thing. So that way, yeah, it's an auto injector. But anyways, so we grabbed the crash cart and then we were trying to give him the dose of the epinephrine. And my coworker realized that whoever stopped the crash cart put the demonstrator epinephrine pen in there, which is what we use for like patients who have never used this before. So it obviously doesn't have any medication in it. It literally is just to show a patient how to do this. So yeah, so the person who started the crash cart put that in there. So then we were trying to figure out where the heck the actual epinephrine pen is, because that's where we would keep it. We wouldn't keep it in the normal med cabinet because if we needed that, it would be an emergency. So anyways, I ran out trying to find where the actual epinephrine pen is. My boss had found out what's going on, so she's trying to find it as well. She finally finds an EpiPen. We both run back to the room to help out, but then my boss forgets that with an EpiPen, the trigger on it is where the needle comes out of. Because we're used to having to push the plunger to then inject the medication, but that's not how this works. It is the button on it. It's button activated, so the button, when you press it against the skin, has the needle that comes out. She pressed it with her thumb, so the needle went through her thumb, injecting herself with epinephrine a little bit, and then that was just a wasted dose. So then we're like, okay, now we need to find another one. In the meantime, you have epinephrine that are in these glass ampules, which are just kind of a pain in the butt because you have to make sure when someone's having an allergic reaction, they're not the most handy because you have to, the glass ampule, you have to make sure when you break it apart, you use a filter needle so you don't get any little glass pieces inside there, and then switch the needle. But anyways, my coworker this was the one that gave the injection. This is the first time she's had someone have this response. So she's like freaking out and shaking, and then she cuts herself on the glass ampule part while she's withdrawing the medication. So then that was another wasted dosage. But anyways, we finally found another EpiPen and gave it to the guy. Everything was okay, but it was just a ridiculous situation. Like I couldn't imagine being someone laying there who is swelling up, you're super itchy, you're having a hard time breathing, you're surrounded by like 3 or 4 nurses and a doctor, and you have the crash cart, the EpiPen isn't working, then someone finally comes in with an EpiPen, but then injects himself. So then, because you're kind of like sitting there and you're like, okay, finally, relief. And then it's like, nope, never mind, they just injected themselves. Okay, now this person is drawing up stuff from the vial and then they cut themselves. And, again, you're like, okay, good. Now I have relief. But then, then they cut themselves and you're like, crap. And then finally you have another person that comes in and then you're probably thinking like, okay, what's going to happen with this one? It was ridiculous. It was crazy. I was panicking because we've never had a situation. I mean, when you grab the crash cart, you just expect everything that you need to be in there. So yeah, like instantly, as soon as I usually am pretty good under pressure and during emergency situations, but not having what you needed where it was supposed to be and then trying to figure out where else that object might be when it's not where it's supposed to be instantly kind of had me in a panic. And then once we found it and I was relieved and then my boss injected herself with it, it was like, okay, now we gotta go try to find another one. It was an insane situation. It was this poor guy. Like, he definitely could have sued our office for sure. And that was definitely a big deal. I mean, we all had to go through training on what needs to be in a crash cart, check expiration dates, and making sure that you actually have the real item in there. Yeah, it was pretty crazy. I think he did. I don't think he came back for his allergy injections though. I think he went to his allergist for that from then on. But I think he did come back, and he was super understanding. He was super friendly. Um, he wasn't even like upset, or at least he didn't seem like he was upset. But I mean, I don't know if that was me in that situation, and then that kept happening where people were coming in, and you're like, basically, each time you're thinking like, oh, okay, sweet, now they have it, and then something happens, and I don't know. I was like, yeah, a patient of the year, basically. I mean, oh god, it was insane. I mean, we had only left the room for like a minute, not even maybe before we found the first EpiPen, and from that time, like by the time we came back, he was covered in hives from head to toe and was super red. So, and then she did that, so it was like it was insane. I felt so bad for him. The only other time I've ever experienced someone who actually had an anaphylactic reaction was someone who came in to the walk-in clinic that they had gone for a hike, and she stepped, like sometimes bees like make nests in the ground, and she had like stepped basically on their nest. She got stung by a bunch of bees, and she came in and like instantly I kind of could tell what would happen. Um, but she was completely covered in hives. She was having trouble breathing. She was like super red and everything. But this time, like everything was in the crash cart, so it was okay. Like it does get pretty intense and everything, but yeah, in those emergency situations, the best thing for you to do is to remain calm, because you do know what you need to do and you do need to act fast, but you just need to, the more you panic, the more that person panics, and the more they panic, the more, like the faster that anaphylactic response is going. So they're going to start having more severe trouble breathing a lot faster. But we want to try to get that epinephrine in them as soon as possible. So, but yeah, that was the only other time I've experienced something as severe as that. But actually, that one was kind of funny though, because she came and got stung by like a ton of bees. But then afterwards, she, as a thank you, for everything, like she sent me and the provider that were working that day, we each got honey, which was just kind of funny because it was she had allergic reaction disease. So, but yeah, that one I was much more calm and okay for because I personally stocked the crash cart, so I knew it was there and everything was going to be fine. So like everything was good. It was just making sure you get them stuff right away. And I think more like that with the patient. Like of course they're panicking and everything, but I know what to do. But it was with like their spouse was with them and they were panicking and freaking out, and they were just also not to be rude, but they were kind of like in the way because they're trying to comfort their spouse and everything, of course. But then it's like, I need to be where you are. So, um, and that's why it kind of sucks because when you have someone come in for an emergency, like you don't want to kick the spouse out and be mean, but at the same time, it's just because sometimes they get kind of in the way of where you need to be. And, you're not trying to be rude. You know that they're scared too. And it's more comforting for the patient too to have their significant other with them. But yeah, it just tends to be like it's just a lot easier to get them out of the way, and then they're asking questions while you're trying to do things, and you're like, I can't really answer you right now because I need to focus on what I'm doing. And yeah, I have seen that. I like watching all of those like things. What's that other one where they have like parasites or something? Monsters Inside Me. I like that one too. Mm-hmm. Yeah, most of the time, like once you've been in an emergency situation a few times, you kind of it's not like you're settled down, but like you know what to do, and so you're not panicking. And then you also don't really feel as bad having to like kick the spouse out or whatever. The only time I do feel bad though is like if it's a kid and you have to keep their parent out because they are losing their mind and they want to know what the heck is going on. They want to be there, and everything. And you have to like kick them out so you can do what you do. And like of course, they're having a panic attack. So, oh god, I bet that would be a mess. There's been some interesting ones on there. But yeah, for this one, so there's not going to be a test on this chapter, but what there will be is either you can write like an essay or make a PowerPoint. Doesn't have to be, I mean, of course, this one is like 30 something, slides long, but for the PowerPoint, it's basically you want to do it as if like you were going to explain it to a patient. So explaining like, how your how the lymphatic system works and what the sole purpose of it is, and then also just explaining as well the different stages of allergies and your immune response, so kind of how that immune response works, as well as just some of the common, the uh, viral hepatitis, strep throat, things like that, those common symptoms, and then some diagnostic things, so how we test for it, and treatments and stuff. So yeah, any questions? You mean like post the PowerPoint in there, or post what you need to? So what I have in there, just so I can make sure what. Hold on, I'll show you what it looks like. So when you go into your, oops, sorry, my thing's a little. Hold on. Okay, so when you go in there, it's going to show chapter 33 presentation. When you click in there, it'll give you all the instructions. It'll say your essay or presentation needs to explain, the lymphatic system, the types of immunity, and then everything else that it needs to include too. Is that what you're talking about? Okay, yep. So that is already posted in there for you. No, I just posted it like 5 minutes before I started the lesson. So you're good. All right, well, thank you, Tahila. And then we will have another, it'll be kind of more like just a catch up on Thursday of what we've gone over so far with this mod, okay? No problem. See you later.